Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter O. I'm going to continue today on the ocular diseases, which is the last video of this eye diseases. Today I'm going to talk about in terms of the eye exam or preventive or the signs or symptoms indicating that it's quite a serious problem. So it's just the general, because we all have once in a while feel foreign body sensation, feel dry, and then probably from looking on the screen too long time, or lack of sleep, or dehydration, or really the true foreign body, but it's just gone a couple minutes or a couple hours later, or after a night's sleep. But I'm going to talk about those signs that are really persistent and really indicating, even though probably it's minor, just dry eye syndrome, but it's kind of really tough to manage, and it's a chronic long-term process. So I'm going to focus on those kind of problems today. And before I talk about that, just bring up the emergency situation. I think I mentioned so many times. Again, I just repeat briefly, like the injury or foreign body, or sudden feel eye pain, or loss of vision acuity, or bleeding. Even though it's very superficial, you know it's probably just the conjunctival blood vessel, or any kind of symptoms like I mentioned here for the healthy people. And for those who have systemic diseases, you feel like curtain falling off, or you really vision get blurred and not clear, blurred. So you need to see your doctors. The choices of emergency, or your ophthalmologist, or you can see your primary physician, see whether there's some simple like problem can be managed in the general, or your family physician or your primary care physicians. If not, they will refer to the ophthalmologist, or you go to your eye doctor right away. So these are the emergency situation I just briefly mentioned here. And in terms of preventive, the eye, I think eye exam different age for the young kids, the newborn, the eye exam, and follow up monthly, follow up regularly, not monthly, 2 weeks, 2 months, 4 months, 6 months with the immunization. And the ocular exam not follow that, I think, unless you notice some problem, or usually at different age, every 1 or 2 years, and to do the eye exam. And for adult also, normal adult preventive care is, I think, every 1 or 2 years for the eye exam. Depends on the age, and depends on the insurance, or depends on your physician's recommendations. For the children with nearsighted, that's quite common. Usually, like probably the teacher is the one who really the first one to identify your child might have the vision problem, probably nearsighted, or cannot see clearly because they cannot see the people, cannot see the teacher, cannot see something on the board. So this is, if that's the case, bring your child for the evaluation. It's very straightforward procedure, and then will make a difference in child's life. Actually, I think there was a study said the uncorrected nearsighted children will impair not just the intelligence, because cannot see clearly, also the psychological have impact on psychological development. So if you, or as parents or as teacher, if you notice, bring this up to the physician to get it examined and get glasses and to correct it. And also for the middle aged, usually for the middle age healthy people, again every 2 years probably, and if you wear glasses, of course your physician will tell you. The nearsighted, by the way, for the glasses, for the children growing year, probably need to recheck every year, because during the development, the eye size change and the diameter change might change the prescription for the eyeglasses. For adult, grown-up adult, healthy, probably quite stable. So every 2 years also, that's probably the widely recommended schedule for the eye exam. But like I said, there's still some exceptions, and individualized medication, individualized medicine. If your physician recommends you to see your eye doctor to get glasses checked, follow their advices, either once a year, or twice a year, or depends on the situation. And for what are the symptoms really indicating you need to see your eye doctors? First of all, like I said, foreign body sensation, not just one time, couple hours, couple minutes, but it just keep going every day, particularly for those working in the special environment. Use you're in the dark or any kind of situation. If you feel your eye really feel foreign body sensation, itching, not allergy season, you know you do not have allergy, and get it checked. Probably the dry eye syndrome doesn't have to occur in the season of allergy. It just is there because it's the component of the lipid from the eyelid glands. That's different from the people without this dry eye syndrome. So if that's the case, get it, see your physician and to prescribe either tell you, otherwise you take the over-the-counter medication or take the eye drops from prescription or over-the-counter. But will make you feel better, will soothe the feeling of the dryness or foreign body sensation. And also the vision change. If you know you have glasses and the glasses was just had 1 year, or particularly within 1 year, you feel your vision decrease, that's for adult, young adult or middle-aged adult, then probably something else. It's not, because for the nearsighted, usually it's quite stable when you get into the adult stage. So, but still there's some change of prescription, minor, but still if you feel like this kind of vision change, not as clear as usual or as before, get it checked. Probably there's something, like I said, the edema under the retina. That's, even though it may self-limited, but still sometimes if the edema, the volume is big enough, can really lift up all the retina, getting worse. Usually those occur with the systemic disease or other risk factors, but still get it checked and if necessary, do the laser to stable it back to the eye structure. Stable, I mean, it's just fix it. So this is about the vision acuity. Or if you, for young people, healthy, either young adult or middle-aged adult, you probably have seen the red eyes, one eye, you know it's bleeding. Sometimes it's really not serious, just conjunctival blood vessels getting somehow stretched or bleeding, can be a minor. A couple of days will go away, but I still think you need to get it checked to make sure it's not from bleeding from deeper tissue. And also for those older or systemic disease, of course you follow with your eye doctor regularly. Depends on the severity of your disease. If you already have the retinopathy from those hypertension or diabetes, I think the follow-up is really based on your ophthalmology, what they recommend you. Or if you just newly diagnosed diabetes or hypertension, then you need to follow up regularly to check the progress and whether there's retinopathy developed or stop at an early stage. And for this group of people, also the other important symptom is the decreased vision at night, is a cataract, because the degenerative change of the lenses. So if that's the case, if you have those kind of problem, and particularly if you need to drive at night, then I really recommend you to drive at night frequently, not occasionally. Then you just be careful. But if you need to drive at night frequently and you have this glare, not clear, then you need to get your to see your eye doctor to evaluate, to see whether there's something can slow down the progress or can do the surgery to correct it. And these are the very kind of not emergency, but still serious enough to alert you to see your eye doctor or your physician. Of course, I mentioned the emergency situation. So this is for those. The other important, I think, disease is glaucoma. Of course, it's already I mentioned so many times. If you're interested, you can follow my previous video on glaucoma. I'm not going to spend time on it again, but still a lot of normal pressure glaucoma. It's a chronic process. The consequence, the worst consequence is the optic nerve is completely cut off the supply, or undergoing ischemic damage can lose the vision or lose the partial field of vision. And so this is the end. If you notice your vision field change, for example, you cannot, once in a while the recommendation is cover your one eye to see whether you can see all the degrees or circle around you. If you cannot see, or if you feel like one corner is not as the other corner, is not as clear as the other corner, or any kind of this visual field change, you need to see your doctor. That's indicating probably neurological problem, may identify the serious problem. Sometimes brain disease or brain tumor, for example, pituitary tumor, can really cause these first signs as vision field defect. So again, the whole taking home message is pay attention to your eyes and do self covering one eye to see whether there's any change of the visual acuity or visual field, and if there is any, check with your eye doctor or your physician. So I'm going to stop here, and the video is longer than expected because I just covered everything in this video in terms of what kind of signs to alert you to see your doctor. So I'm going to stop here, and thank you for watching. I'll see you next time.